friends, welcome to EduSkills OET Made Easy. This is a very different approach to OET learning. So today we are going to deal with Occupational English Test, Speaking, OET 2.0. And it's a wonderful thing, It's something entirely different from all other subtests. It has got its own beauty. So we'll discuss about the speaking skills today. And what we deal with today is the first thing is speaking subtest overview. What is the overview? Basic thing. And we'll also look into the role play structure. And thirdly, skills framework setting. Fourth, revised assessment criteria, under which we'll look into linguistic criteria and communication criteria. And clinical skills framework, where we'll have information gathering framework, where we learn something about question format and the syntax, the word order in a sentence. And also we'll learn information giving framework, where we'll learn how to define, describe, and give them the feedback. These are the major aspects being requested by many of the aspirants. So we will focus on those things in a detailed way. And pain assessment criteria or condition assessment criteria will have, in general, can do the assessment. What are the criteria? And specifically, we will take pain as an example. And I'll give you 3 options. So for everything, in general, you have a lot of options whereby you can use some criteria to assess the patient. Okay, speaking success. What does bring success in speaking? There are a few things. First thing is competency. Second thing is confidence. Competency, when I say what all your practice, your knowledge, your skills, everything together brings in competency to a person. And all these two must be connected with an attitude. In speaking subtests, it's not that you have not practiced or you haven't got the competency that you do not succeed, but mainly because of the attitude that you have. And when I say attitude, you will have to think of things like, how do you think of the exam? Always I give an example, I have a neighbor, long back we had a neighbor named Mr. Neman Gowda. And there is a village where these people used to have a lot of paddy fields and very, very economically sound family there were. So when I was small, maybe in 3rd standard or 4th standard, I used to get into their house when I return from my school. I used to enter their house and eat some beaten rice or something like that. Every day, lady used to give me. She was very fond of me, But then their mother tongue is Tulu. So the way she used to communicate certain things embarrassed me. For example, you may not understand Tulu, I believe. Yes, she used to say when the tea powder gets exhausted in the house, like if the tea powder is over and she needs to get some tea powder from the shop, the way she used to tell in Tulu is that she used to tell the man of the house, if you translate it into English, the tea powder container is overflowing with tea powder. Please go to the shop and bring some tea powder. Maybe there are some guests in the house or something like that. So also if the rice exhausted in the house, she used to say like the rice container is overflowing with rice. Please go to the shop and fetch some rice. So I was irritated with this because the man was working in the paddy field and he has to wash himself and walk around 2 miles away, go to the shop and fetch the tea powder or rice, whatever she asked for. So I asked my mother, why is that she is irritating that man when it's overflowing, when the tea powder is overflowing in the tea powder container? Then she said it's the custom, the way they speak. I did not understand. Later on, when I did my comparative religion studies, I realized there is a belief in Hindu mythology or theology. There is a controversy still. Hindus believe in something called Astu goddesses. Astu Devatagal, they say. No? Astu Devatas. Astu goddesses. They call it them Astu goddesses because their continuous mantra is Tatastu. They keep on saying Tatastu. You know the meaning of Tatastu. Astu means let it be done. Tata means so. Let it be done so. So she believed, this Nemana Gowda's wife, this lady, this woman believed that if I say something is exhausted, she believed that the house will not have richness. It will not have infilling in the house. So you always used to say it's overflowing. She never used to say something is empty or kali or something like that. She never used to say. And probably in Malayalam, they say illakam pada, something like that. So the fact is this, though it's a old mythology or theological belief, this has got a great aspect of psychological influence on human beings. For example, if I start, if you ring up to somebody, you have exam immediately, the OET test you have to appear in the near future, and you ask somebody, how is your practice going on? Come on, Baba, I am trying to practice, but nothing enters my head. All the thousands of the Astu goddesses, whom you cannot see with your eyes, they believe, they will repeat saying, Tatastu means let it be done, let it be so. So if you say nothing is entering my head, or any student preparing for the exam, being informed or called up by, contacted by her friend or someone, if she says, I am doing my practice, I am studying, I am reading, but nothing enters my head, nothing will enter their head, because all the goddesses will say Tatastu. So first of all, our attitude should be, we'll be able to crack this exam. I will do it. The fact you say when in the morning you get up and say the day is so tiresome and boring, the day will be tiresome and dog boring, because all the goddesses will say Tatastu. Okay, so definitely believe that. Give positive suggestions to your mind. Feel 100% sure I am going to crack OET this time. There is no other way, but definitely I will crack. So have that confidence, that feeling, that attitude. And that's what brings in confidence. So only competence will not give you a good hand. So I was speaking about competency, confidence. So how can you achieve this confidence? Even if you have competency, even if you have practiced so many times, all the role play class, and you are good at English, but if you don't have confidence, you will never be able to perform well. So the best way to build up your confidence is to record yourself. Record yourself and listen to your video. Even you can have a video, that's better. Or video, audio recording sometimes you can do, or video recording in your own smartphone, so you can do and listen to yourself. And if you want to send it to somebody, to a friend of yours, and send it to them and find what is wrong or what has to be improved, all those things. Okay, record yourself. You can also do some testimonials or some speaking. Record your speaking with your friend or speaking partner, and that will give you a lot of confidence. In the beginning, it's very, very difficult and very challenging, and you may never want to do that, but try to do that. Second one, have a speaking partner. Majority of the people here in this platform, here I have given you platform partners. I think I have given to everybody who ever asked. Maybe 2 are left, those who asked me yesterday or day before. If you are not given the partner because maybe I lost your request or it was swept out with a lot of requests later on, so you'll have to remind me again. So have a speaking partner and assess yourself. Beware of illusion of competency. Illusion of competency is knowledge. You have knowledge. For example, you attend my sessions and say, wonderful, great, superb, excellent, awesome. It's knowledge. You understood what it is. But knowledge will have to be translated into skills by constant practice. It takes patience. Knowledge without skills is called illusion of competency. That is the greatest enemy that OET aspirants will face. And I've been seeing, for example, once you get B in your speaking or one module, then you don't get B in other modules. You just ignore that particular module saying that I am okay with that. But I tell you, the competency will not remain. That is an illusion. Maybe you got it in a particular test, you got your B. That doesn't guarantee you a B always. So beware of the illusion of competency. Now, some of you are telling me that, okay, sometimes I find it very hard to follow the method. It's hard, but then you have to do it with patience. That's why I said, don't go into practicing all the modules every day. Just take up, I told you, even a part A of B, listening or reading. Just do that. Or take one case note and try to analyze it. Find out what are important. What is the purpose of the case? Whom am I going to write? All those basic things to analyze and make a schema of it. That's enough for the day. But let it be getting into a whole existence. Make it a skills means it becomes a part of your existence, your being. It's not something in your brain or something outside. The whole being is involved. All person is involved in that aspect when you are doing something, when you have a particular skill. So beware of the illusion of competency. That is the greatest enemy. It is not the quantity of the practice or learning you had, but the quality of practice that matters. I told you, someone who has done strategically 10 practice tests can override those who have done 150 practice tests without any strategies. So have patience and try to apply strategies. Now, speaking test overview, we are going very fast because I am sure most of you are aware of that. I'll just give you an idea, brief idea. So who is the interviewer? Duration of the speaking test, procedure, preparation time 3 minutes. How many role plays will have to handle? Duration of each role play. And interlocutor is the interviewer. And this is the best part of OET subtest, speaking subtest, because there is no examiner or assessor over there. No, other one is an interlocutor. He is an actor in the role play, and maybe equally tense like you. So they have a task to be done, maybe a paid actor. So definitely their business, the examination system, this particular platform, even IELTS or TOEFL, those PTE exams, the examiner really wants to make you comfortable. The interlocutor, the success of the interlocutor or efficiency depends on making you comfortable and helping you out to come out with your real self, to bring out all your skills. So always the interlocutor will be very supportive to you. And definitely, those things that you can ask them questions. If you don't know how to particular word, you can definitely ask them during the 3 minutes preparation time. Or if you have some queries, you can ask them. Definitely they will help you out. So always they are there to support you, feel that. And you aren't in front of an examiner or assessor. Your thing will not be assessed then and there, but it will be recorded, and the recording will be assessed by two benchmark teacher assessors later. So what I'm telling you, the consciousness that's being recorded also will give hurt your confidence. That's why I asked you to record yourself, or record if you are interested. Definitely I'll give you chances every week. We'll have weekly sessions this week onwards, coming week onwards, whereby you will be speaking and I'll be joining you, and we'll record it and we'll assess you. That's the only way out that you can do it. But then usually people don't do that. That's why they find it hard to manage or face the situation in the speaking sub-test. So the best part is there is no examiner, no assessor in front of you. There's only a co-actor. Both of you are acting in a role play, and definitely being the girls or nurses, women folk, the fair sex, they have a better acting capacity, I believe. So you can do it excellently. And duration of the speaking test, 20 minutes approximately, the total thing. And you know those things. Warm up not assessed, warm up questions are not assessed, but definitely that is the best chance for you to create a best first impression, which will be lasting. So even if it is not assessed, don't take it lightly, but feel it very comfortable because you are not being assessed for that particular portion of it. And definitely, you can create a first impression over there. And 2 role plays will be assessed. And preparation time for each role play, 3 minutes. And how many role plays? 2. And duration of role plays 5 minutes. You will be acting with a interlocutor 5 minutes each for each role play. Okay, that's the basic idea. Now role play structure. Okay, always I told you the structure is very important. The sequence is very important. The logical development is very important. In all the subtests I have been telling you, the structure, the sequence is the thing that will give you success. So role play structure, starting the interview, the creating all those parts. Taking patient history and explaining a medical condition or procedure. And I'll give you a clear idea how to explain a medical condition or what is the procedure, and providing reassurance and education, and ending the interview. Okay, all these aspects are important and will be assessed. This structure need to be taken into consideration. With this, you will be providing a structure with all these aspects and building rapport with the patient. Building rapport means you will have give and take. You will feel comfortable. The patient will feel comfortable with you if it is a patient or somebody, or the carer of the patient, or whatever the situation is. The other person whom you are concerned with will have to build up a rapport with you. So they are very open and feel comfortable. Now, so what is the test setting? All were asking me the scenario, and definitely we'll have details later, but then now I'll just give you some examples of settings. The settings could be the day-to-day real life settings, scenarios that you are facing as nurses or health professionals or doctors. Hospital ward or hospital outpatients, OPs, emergency department of a hospital, local pharmacy or chemist, radiography practice, home visit, suburban physiotherapy clinic for physiotherapy purpose, private practice or suburban clinic, and community health center and suburban dental clinic. These are the settings you will find usually. Now, next is skills framework. What are the skills required? Linguistic skills and clinical communication skills. So revised assessment criteria, they have given up something like task achievement. Those aspects are given up. They don't really have it now. So you have linguistic criteria and clinical communication criteria. Now, what is the weightage given? You should definitely have a clear idea of these things. Then only you'll be able to tackle the whole subtest. See, linguistic criteria, there are 4 criteria. Each criteria will be marked 0 to 6. So per criteria, 6 marks is the maximum. Total will be 24 marks. And communication criteria, you have 5 criteria, 5 segments to approach, and 3 marks each. 3 marks each. So total will be 15 marks. Now you know the weightage of each segment. So almost linguistic criteria will take 2/3 of your marks, and communication criteria will take 1/3 of your mark. Okay. So revised assessment criteria, just we are going very fast on that. We will not be able to deal with everything. And if you have any concerns, as usual, just grab a piece of paper and write down, and I'll come back to that particular aspect at the end of the session. So revised assessment criteria, 2018 September it was revised, and as as of now, the criteria goes like this. The first part is linguistic criteria. Intelligibility, we will deal with it later. Intelligibility, it will be marked, scored 1 to 6 marks. So the least will be 1, otherwise it will be 6. So fluency will be marked from 1 to 6, and appropriateness of language will be marked 1 to 6, and grammar and expression, your grammatical resources will be marked from 1 to 6. So these are the aspects as I told you. And now communication criteria or clinical communication criteria, relationship building will be marked 1 to 3 or 0 3, whatever you want to understand. Understanding and incorporating patient's perspective will be scored 1 to 3, and providing structure 1 to 3, and information gathering 1 to 3, and information giving 1 to 3. And as far as I understand from your responses, I understand the information gathering and information giving is the biggest challenge most of you are facing. So we'll be dealing with those things. So these are the aspects. You have 24 marks here and 15 marks here. So total of 39 marks. Okay, so revised assessment criteria, linguistic criteria. Let's have a look at what is the linguistic criteria. What do they expect from you? Intelligibility, fluency, appropriateness of language, and grammatical resource, grammar and expression. So which I put it as GAFI, mnemonics. So linguistic criteria, first one is intelligibility. What does it mean? The acronym I have is PARIS. The 5 aspects under intelligibility that you have considered. I take it as PARIS. P stands for pronunciation. T stands for pronunciation. So instead of pronunciation, if you say pronunciation, that will be something wrong. Or if instead of academic, if you say academic, that will be difficult. Instead of food, if you say foot, it will become foot, F-O-O-T. It will sound foot instead of food. So pronunciation is important. In the sense, basic sounds you should be able to produce. Those expressions, police station, or examination, all those accents and things should be dealt with properly. And for example, magazine, the long and short vowels should be used properly. Potato. Instead of potato, if you say potato, they may not understand. That's our issue. Intelligibility means they should be able to understand without any difficulty. The patient or whoever you are communicating with, they should be able to understand. Otherwise, they will understand food as food. Instead of food, it will become foot. So the spellings may be same, the pronunciation is different. So those things will have to be looked into. And the second one is accent. The L1 influence. There are videos or teachers who are telling L1, your mother tongue influence should not be there. No, that's not the fact. Cambridge accepts a certain portion of L1 influence. L1 influence is your mother tongue influence. And English has got its own different accents. Definitely, there are different 6 officially approved variations or dialects of English, and they have different accents. So definitely you can have a particular sort of a portion of your thing, mother tongue influence, definitely you will have. And you are not supposed to speak like a born in a British man or American or something like that. But then you should be able to make it intelligible. Your accent should be intelligible to the other person. You should not be stressing somewhere where that should not be stressed. And as I told you earlier, the grammatical aspects should be slided. It should not be stressed. And you should know where the stress is. And Paris, R stands for rhythm. You know, there is a rhythm for everything. When you ask a question, you question ends with a high tone. And when you speak, normal statements, it will end with a lower tone and a normal tone, all those things, rhythm. Last one is stress. As I told you, able, the stress is on first syllable. The ability, stress shifts to second syllable. Responsibility, the stress shift to the third syllable. So instead of able, you cannot say able. There is no stress. People may not be able to, the listener may not be able to understand you. So able, ability, responsibility. So the stress should go to the place where it has to be. For example, examination. Whenever any word that ends with the shen sound, T-I-O-N, shen sound, we call it, the just previous syllable will be stressed. As you have on the screen, pronunciation, examination, telecommunication, abbreviation, all those basic stress matters should be dealt with. This is what intelligibility we mean. So these are the criteria being assessed, 1 to 6. Yes. Second aspect in the linguistic criteria is fluency. What I'm telling you, unless you know what are this assessing, you'll not be able to tackle those things. And later I'll be also letting you know how to assess your own speaking. Record your speaking and assess under these aspects. These are the criteria. Each criteria will be assessed. It's not like our traditional system. They assess your papers. They have detailed assessment for each segment. They will give you the score. maybe fluency is scored 1 to 6 or 0 to 6, they will have to look into 1, 2, 3. What was the fluency aspect? So doing best, maybe in the writing also, I used to tell the aspirants, sometimes their letter is the best ever one. But in one aspect, they have gotten out of 6 criterias. In all the 5 criterias, they got a B grade. But when they wrote the purpose, it was not clear. They lost it there. So never they will be able to reach B. They will go to a C plus or C. So every aspect should be looked into. That's why I called it as a competitive examination. No, occupational English test. It's a professional examination. Every aspect is important. You should be able to assess your own recording, your own speaking using all these aspects. So fluent speech, normal speed, neither too fast nor too slow, normal speed. And repetition, not appreciated too much. Self-correction, some people always say it's not allowed, but normally it is allowed even for the native speakers to correct themselves. But it not be very often. Even sometimes natural self-correction, maybe you made a mistake, then you corrected yourself, can give you a positive grade. And fillers like all those things. Sometimes official English, definitely sometimes natural fillers are allowed, but it should not be interfering your fluency. They should be restricted. And some people keep on saying, that should not be there. Like sometimes it can be, some sounds, some fillers can come in, but restrict it to the minimum. And no unnecessary hesitations like searching for words or structures. Like, you are not able to complete the sentence. That is hesitation. What you call, you start a compound sentence or a complex sentence, but you're not able to end it. You are not able to put a full stop somewhere. So that is hesitation. That will be a very bad thing. So you should be able to go fluently without searching for words and structures. Structures means syntax, the sentence. And I'm going to give you a very, very beautiful and novel idea today. If you haven't booked your exam and you are not going to write immediately, you can definitely practice. I'll come to that. And appropriateness of language. Appropriateness of language means, simply speaking, English, you don't need to use any jargons over here. You don't require technical. Most of the time, you are speaking to a patient, a common man, or to a parent or guardian of the patient, where you need to use layman's words, layman's speech, common man's language. So that is called appropriateness of language. Lay terms, layman's language should be used. Your communication should be understood by the person with whom you are communicating. So that's the basic thing. So explain technical terms in lay terms. So you'll have to say, like, you cannot use the medical terms. Like if you use some very academic terms, you'll have to ask in simple terms. Your ability to explain technical terms, technical aspects in very simple layman's language or layman terms, that's being assessed here. So that also will be scored 0 to 6 or 1 to 6, whatever you want to consider. And linguistic criteria 4, grammar and expression, your resourcefulness of grammar. And your grammar should be rich and flexible. As I told you, you should be definitely able to use simple sentence, compound sentence, and complex sentences, and sometimes compound complex sentences. Otherwise, it will be called a redundancy. You'll be continuously using simple sentences that will not be appreciated. And you should be flexible. You should be able to change your structure, sentence structure as needed. And grammatical range, that's what a grammatical range, different sentence structures. And I'll tell you what is syntax or the structure of a sentence or a question format, all those things. Vocabulary, accurate and flexible. Accurate to the person to whom you are communicating, to the profession in which you are working, and flexible. That can be changed, your words can be changed and used it very flexible and normal into the common man's language. And the last one is idiomatic speech. If you are able to use some idioms, you will not be by hurting idioms and using them for the purpose of using idioms, but you should be able to use some of them in your conversation. Gives a beauty to the language. That's what about the whole thing about linguistic criteria. The next aspect is communication criteria, or you can call it clinical communication criteria. I call it RUSIC, the acronym abbreviation that I use. And the first aspect is relationship building. All these aspects will be scored from 1 to 3 or 0 to 3. The highest score will be 3. And your assessment, your score will be allotted to each segment of this. They're not giving in bulk, okay, she has done well, come on now, we'll give this score. No, they'll be grading you on each of these aspects. First one is relationship building. Second one, understanding and incorporating patient's perspective. And third one, providing structure. I told you structure is always important in all your tests. And fourth one is information gathering. And the fifth one is information giving. And maximum concerns I got from the last two aspects. So today we'll be dealing mainly on those things. By the meantime, you'll also have other aspects being assessed. So we are going into those aspects. First one, relationship building. What does it mean? The score, as I told you, 0 to 3 or 1 to 3. Initiating the interaction. As I said, you should be able to start properly, like with a good morning or greeting, whatever you want to. However, initiate the interaction and believe that you are in control of the situation, not the patient. You should be in control of the situation, who has to take control of the conversation. So you are the one who has to initiate interaction, and don't wait for them to greet you and feel comfortable and happy. Okay? So you have to initiate the interaction, begin the interaction. And second one, attentive and respectful attitude. You should be attentive in the sense, though it is a speaking subtest, your listening will be definitely playing a great role in this particular subtest. So be attentive to the patients or the patient carers, whoever it is, to their needs and respective attitude. In the sense, you need to ask the permission if you have to touch them or if you have to do something, some assessments. You need to ask their permission politely, use very polite language, and be respectful towards them. And non-judgmental approach. Sometimes you know the things very well, but then you immediately don't judge the things. Try to understand from their perspective. Don't go to the final judgment immediately and tell them that you are wrong or something like that. Showing empathy, getting into their own shoes. Showing empathy means you cannot show empathy unless you are able to get into their own shoes. That's naturally what happens in your nursing care. That's what empathy is. As I told you, always I remember two people who assisted me, two nurses, Ruby and Janshi, in the Unity Health Center in the ICU when I was on my deathbed almost. The way they used to, even when I was semi-conscious, when I could not respond, they thought I am unconscious. They used to both of them used to speak, discuss about me and literally shed tears. So that is really empathy. They used to feel my pain. They got into my shoes. So that's called empathy. So try to get involved in the situation. I may not tell you that because being nurses, that's my experience. I'm remembering them even after 2 decades. Almost every day I remember them in my prayers. I don't know where they are. But still, what I'm telling you, because of their empathy, that had an impression on my whole existence or being or my future, okay, or my life, entire being. So that you are familiar with, I need not teach you all those things. These are very similar thing as you have a common thing every day in your professional life. And the criteria, clinical communication criteria or communication criteria, second aspect is understanding and incorporating patient's perspective. Eliciting and exploring patients' ideas, concerns, and expectations. Eliciting means you have to draw out. You have to first draw out from them, explore patients' ideas. What are their ideas, concerns, expectations? Don't worry about anything. Just try to listen to them and explore their concerns. What are their concerns? What is disturbing them? That should be your focus. And picking up patient cues. When patients speak something specific or some special aspects, some special concerns, pick those patient cues and try to continue the communication. The next one is relating explanation to elicited concerns or expectations. Your explanations to go in connection with the concerns of the patients, expectations or ideas or concepts the patient is entertaining. So relate them exactly properly with the patient concerns and expectations. Now, the third aspect, providing structure, sequencing the interview. I told you that's the beauty of every subtest. And purposefully, what is your purpose? You should sequence the interview purposefully, and you have a clear purpose given in your role play card. It's not like of the revised version of OET 2.0, you have more details given the cue card. Earlier, you did not have so much details. So you have the purpose or the sequence given in your role play card. And logically, I told you there should be some logic, some connection from one part to next part. You should be able to explain to them clearly. Firstly, secondly, let me tell you a few things. Okay. First of all, secondly, thirdly. So signposting, changes in topic. That's what I said. Signposting in the sense. Let's come to the next aspect, next concern that you raised. So first you address one concern, then you go to the next concern. So signpost it and tell them this is going to be the next aspect I am going to deal with. Let it be very clear to them. And also the other one is organizing explanations. So you should be able to organize your explanations one by one. And I'll clearly give you the structure, one of the slides that we will be dealing immediately. And communication criteria, fourth one is information gathering. All these things are there given in the assessment criteria given in the OET official website. You can definitely download a copy from there. But then I'm giving you a brief explanation and trying to explain even more to assist your performance. So information gathering is one of the important things in facilitating the patient's narrative. You should be able to facilitate the patient's narrative. You should be able to encourage them to narrate, speak more and more about their concerns and your ability to do that. Initially use of open questions. Initially start simple questions, open questions. Then when you get the answers, definitely you get to the closed questions or other way about. And never ever do use compound or leading questions. Never ever use compound questions means two questions together. What did you do today, yesterday evening, and what happened today morning? Ask one by one. Don't ask to compound questions in the sense many questions. Or leading questions means you are suggesting. You want him to say yes or no. Your questions are such. You have done something like this in the evening, right? So that's a leading question. You cannot ask suggesting those things. Clarifying vague statements. You should be able to clarify if they made some very vague statements which has no clear meaning or you are not sure about it. You should be able to clarify those vague statements and get the explanation from them. And lastly, summarizing information. To encourage connection and invite further information. You will be summarizing information. As you summarize and give the summary of the information, definitely you should be encouraging them to connect and give their opinions, their feelings, add, and definitely they should be able to interrupt. And that's the way you should be giving the summary. Communication criteria, information giving. Establishing initially what the patient knows. First, you should be able to establish what does the patient know about this condition and about the treatment, whatever he knows, you should be able to establish it. And pausing using patient's response to guide next steps. Okay, pause yourself. Like as the patient speaks, you should be able to pause yourself. Don't interfere too often so that patients respond. You can guide them to the next steps. Immediately, you can also use the cues that patients are using. Encouraging patient to contribute reactions and feelings. Even when you speak or summarize, let them contribute their reactions and feelings in between. Encourage that. And checking understanding. Definitely, you should be able to understand, check the understanding. And definitely is one of the most important things in the speaking profession, checking understanding of the students. So make sure they have understood what you wanted to convey to them. And fifth is discovering what further information the patient needs. Definitely you have to ask them, do they need any more information or do they need any more of your assistance before you close your role play? Yes. So we are getting into those prominent aspects which you have asked me about. Majority of you asked me. One is information gathering among the communication criteria. And could you tell me what is the most important skill in speaking subtest? Anybody, please respond. You can unmute and respond or put in the chat box. Yes. Am I audible?
Yes.
Question once again.
Yeah. What is the most important skill that you are practicing as regards speaking subtest?
Whether the patient all the questions answered or not.
Listening to the patient.
Okay, listening to the patient. Any other options?
Reassurance.
And I tell you, in the speaking, it's not your even when you say clinical communication criteria, it is not your professional knowledge is not being assessed here. Even if you make a mistake in your professional knowledge, you will not be losing your score. This is specifically the linguistic criteria and the communication criteria is being assessed, not your medical or professional knowledge. Okay, listening, somebody said. Anything else? Empathy.
Reassurance.
Yeah, layman's speech, good rapport.
Relationship building.
What? Relationship
Empathy.
building.
Empathy.
No, not empathy. Convince the
Patient.
patient, simple language, building relationship, effective communication,
Information
prompt
gathering.
response, information gathering. Yes, information gathering. Yes, under that there is a major skill. That is the foremost important skill, and that's where most of you lose your grade in speaking subtest.
Listening.
No. Those are definitely the skills required, but I am asking you the topmost skill that you require definitely under information gathering.
Understanding patient concern.
No, much before that.
Understand what the patient knows about his problem.
No.
Make the patient happy.
Yeah, somebody hinted. I could not hear properly. How do you framing questions? Framing proper questions. I got maybe 5 questions each from more than 162 people, but I tell you, not even 10% of the questions are correct. When you are not able to ask correct questions, that shows the weakness of your grammatical range and vocabulary. There's a proper syntax, word order for a question. Otherwise, the native speakers will not understand your question. And most of your questions are statements, and at the end, you have to do like this, question mark, no? Are you you are coming with me? Like, no, question mark will be there with the head. You are coming with me? Is it a question?
No.
No, Father.
No, Father.
Today we are going for today we are going shopping. Is it a question? You are okay? Is it a question? You are feeling good?
No, the help. No.
Yeah. So I'm telling you, you have not realized, but this is the greatest challenge you have in your speaking test. They are assessing the syntax, the grammatical range, the vocabulary, the sentence structure. And when you ask questions, you make the maximum mistakes. I tell you, not even 10% of the questions, which I got 5 each from 162 aspirants yesterday, I have collected all those questions. I don't find even, I think it will be less than 10% correct questions. Okay, thank you so much. God bless you all. Yes, thank you. Thank you.